I have to say three things. Thank you very much for the invitation. I will skip some slides because I only have 10 minutes. And sorry for my English, but you can also read the slides and I will leave the full presentation. So I will read, sorry for that. I don't like to read the presentations, but I should. Okay. Comprehensive protection system for early childhood, Chile Crece Contigo, Chile Grows with you. That was the context that I was planning to talk about it. I will go faster. The origins of Chile Grows with you. We have a Presidential Advisory Council on Early Childhood Policy Reform in 2006 by the ex-president of Chile, Michelle Bachelet, and that means a broad range of actors participated in this council. We have hearings with national and international experts on the matter. We have hearings with organizations and individuals who work in the matter. We have written commentaries of thousands of children and adults via websites. And we have a complete diagnosis of the situation of children in Chile. The Chile Grows with You is designed based on scientific evidence. I'm not going to explain that, but we are talking about consolidation and universal application of successful experience and services, national and international experience, the concept of window of opportunity. I don't have to explain to you that. The return on investment, and we have a broad consensus from the unanimous approval of the law, and we are based also in global paradigms, social determinants of health, focus on children's rights, and systemic ecological approach. The principles and foundation, you know the critical periods in child development in human brain. You know about strategic investments. And also, for us, it's very important to understand the multidimensionality and intersectoriality of the childhood development. The child's development is multidimensional. Services and activities should happen at the right time and in a relevant way according to each child's needs. Intersectoral policies allow us to accompany people as they move through different life stages and to improve their personal development skills and quality of life. And through Chile Grows with You, we provide comprehensive assistance to accompany children's developmental trajectory during early childhood, which strengthens the impact of our actions. You don't only need positive environment, you need early stimulation, you need nutrition, you need health and hygiene. You need all of that to occur at the same time and also in the family and in the community. So, I'm sorry. I'm missing one. Okay, I was going to tell you what is Chile Crece with You, Chile Grows with You. It is a system that aids in creating a level playing field for childhood development, addressing the structural causes of poverty and contributing to social mobility. It allows institutional synergy, articulates, organizes, integrates, and provides early childhood care from pregnancy to child's 4th year, supplied by various public services. This way we can monitor the developmental trajectory of each child during the early years of his or her life. And it is a part of the Chilean social protection system. How does it work? I don't need you to look all the graphic. I just need you to see that it has a national program. It's a national program design, but it has local implementation. It's a flexible program. Local communities, local team workers can make their own approach to the design. And this is a very important slide for us. What do we mean when we say personalized follow-up of early child development? I'm going to try to explain the best I can. We have medical checkup and in a program that is called biopsychosocial development support program that is done by the Ministry of Health. And the mother enters to the system, to Chile Grows with You, on her first prenatal checkup. And at that time, it's a biopsychosocial risk identification according to a protocol. And what happens is that mother can have no risk at all, and she's going to be on the program, but she might have a health vulnerability, and so, for example, she should receive a home visit program from the health sector, but also she can have a social vulnerability, and she would be referred to the municipality, and for example, she would have an implementation of the social protection scorecard. But also, the health team can find that she and her families are living in an inadequate housing condition. And of course, it's not the task of the health team to do anything about it. So they have to refer to the municipality, and maybe they can priority access to housing programs. But also, the municipality can find that the family or some children from the family needs education. And of course, it's not their job to do it. And so they have to refer to the educational system. And also, in the educational system, they can find that the children have developmental difficulties, and they have to refer again to the health system. The point is that this should happen at any contact of the children with the different actors who are part of the system. So if the family of the children are in contact with health, education, and municipality, the system would activate if they find any vulnerability. And that is very hard to do, very hard to do. Some of the risk factors that we have tried to identify on mother and children are conflicts with the maternity, insufficient family support, depressive symptoms affected by drug and alcohol abuse, violence against the woman, other vulnerabilities, foster care, and all the risks that you can watch there. And we have a web registration, a referral and monitoring system that we can collect all the data. Just an example that we have all the data from the people we are attending now in Chile. And we try to do a comprehensive social network on Chile Grows with You, with the family always at the center of the public services that are working with the children and with their families. And we have, for the children that are part of the public health system, 2 programs. For children with vulnerabilities, we have a good quality free nursery, school, and kindergarten. We have home visits by health teams, family subsidies, comprehensive care for children with developmental difficulties, technical help for disabled children, and preferential access to the social protection system. And for all Chilean children, we have interactive teaching and informative tools and legislative improvements. And there are program tools. We have 2 programs and different funds for the municipalities. I'm not going to show that. We just have a few photos, personalized health plan, childbirth preparation workshops, personalized assistance during birth, presence of a person of the mother's choice, alternative to anesthesia, assure early bonding, supporting the comprehensive development of hospitalized children. And we have also some services for children who has developmental difficulties. We have today more than 25 types of support services for early 425 types of support services for early stimulation functioning across the country. And we have interactive teaching and informative tools. The interactive teaching and informative tool is the comprehensive protection system for early childhood strategy to create a favorable social environment for the care and stimulation of young children through information and education. She's going to show me the 1 minute. Okay. We have the website, Chile Crece with You. I invite you all to visit. Radio program, Crece Contigo TV, another audio-visual material, and early childhood hotline, and Facebook and Twitter, all the tools that we can use, and websites. We also have I don't know why I lose some. We have a primary Chile Crece Contigo, Chile Grows with You evaluation. I will leave it with you. We are trying to do a lot of evaluation about what we are doing, and some of our, that is the evaluation. You can review it after. And some of our achievements are improvement and increase of the relevant services to support early childhood development, high levels of user satisfaction for biopsychosocial program and newborn program, systematic budget increase of Chile Grows with You, survey of 340 municipal staff members in charge of Chile Crece Contigo in the country, building key performance indicators for every single municipality, so we can say when we are doing it right or we are not doing it right, and progressive increase in the use of the registration, referral, and monitoring system and IT. Just for finish, key elements of the Chile Grows with You experience, mobilizing single discourse on the transformation of society. We can change the reality of children in Chile, building on the national experience, scaling up to the national level of services and activity already existing, creating new skills in the staff involved in Chile Grows with You. The family is the main responsible for the upbringing and developmental of their children. We need to achieve a better and larger information to the families, focus on the quality of our services, focus on the personalized accompaniment of the families, and a welcoming, inclusive, and attentive community giving priority to their young children. Thank you very much.
Thank you very much.